It's so good to have you join me on today's edition of Everyday Life. I am Egu Daniel Ifechikude, but you can call me SUG the General. I won't be doing this alone. I decided to bring back the medical experts, or rather the medical practitioner, who help us understand more about the drug abuse we've been talking about. The last time he was here, we did talk about drug, what an abuse is. We talked about the root cause, and here he is. He will help us talk about the effects. It's good to have you join us, Vito.
Yeah, thank you,
You're
thank you
welcome.
so much.
Hope you had a great Valentine Day.
Yes, I did.
Okay.
By at least I was able to help
You're
some
able to share
persons
love. You're able to
who were
spread
unable
love.
to pay their
Oh wow,
bills. At
nice
least,
one,
yeah,
nice, good of you.
yeah,
And
thank
we
you.
also have Solo Fight. Solo
Um,
Fight, it's good to have you join us.
Always a pleasure.
Solo Fight. I hope your Valentine went well as well.
Just like the normal days that we've been.
So which one did you do? Because there were two activities that day: Valentine and Ash Wednesday.
And
Which one did you do?
Ash Wednesday, I'm not a Catholic, so
Okay.
don't expect me to go.
But not all Catholics. Sometimes
Some people just go.
I've done it before.
What's the
You know,
essence?
when I was in primary school.
When you're in primary school. Well, I was just a normal day.
Okay, all right.
Work for me, nothing special.
Okay.
All right. So let's dive right into the topic we
yeah,
have for today.
we'll be talking about the effects.
Okay.
Like the last time I came,
Yeah.
we talked about what drug abuse is,
Yeah.
and drug abuse has so many effects.
Okay.
It has short-term and long-term effects.
Okay.
You know, like I earlier said, drugs can be taken through the mouth,
Yeah.
that is injection.
Okay.
Some can be taken through
The
the
veins.
veins, and some through inhalation.
Okay.
And depending on the mode of action, I mean mode of intake,
Yeah.
can cause whether long effects or short
effects,
effects.
alright.
Yes. So, like for instance, you can compare the effects being gotten from injection, like say injection
Yeah.
through the veins,
Yeah.
or with the one gotten through injection through your mouth,
Okay.
because that one will pass through the digestive process and all that. The effects are low. But we'll be talking about the real effects on the body. It can affect the brain.
Okay.
It can affect the liver. It can affect the immune system. It can affect even to the kidneys. It can affect the unborn baby.
As
It
for
can-
women.
Yes, the unborn child.
Okay.
It can even affect the way we behave. You understand? And the way we behave has many effects. Even most of the accidents that take place are also gotten from drug intakes, alcohols intake. You understand? And like if I had to break them one after the other, for instance, like the brain, for instance, when we take drugs, or they are drug addicted persons who takes all these hard drugs. When they take it, like earlier I said, it causes a kind of highness in them, which wants them to take more, and so in such doing, it affects the brain. The brain wants to always do it. Whenever they don't have that substance in them,
Yeah.
most of them wants to. They
They are not
feel
comfortable.
they're not comfortable.
They are
They
too-
feel
their body
this
is itchy,
impulsiveness.
yeah.
Yes, they feel this impulsiveness, and these have a very great effect on them.
Okay.
Yes. Then another one is talking about the effects on the heart. It can cause a very high rate, causing the heart rhythm, making the heart to beat faster than normal. And when the heart is beating faster than normal, you know what that could cause.
What can it cause?
And
when
for instance, when it beats faster than normal, the person could develop heart attack.
Okay.
Yes,
That's cardiac arrest.
cardiac arrest and all that. Those you find in people who are addicted using sex stimulants or sex drugs, just drugs to boost
Yeah.
their
Yeah.
sex life
Performance.
performance.
Yeah.
You see, most of them die. Like you must have heard stories, people who die in a hotel, people who die on top of women
Yeah.
and all that. So all these drugs have side effects on them. It also affects the way we take decisions.
Yeah.
I'm talking about the brain now.
Okay.
I've talked about the brain and the heart. The heart's cardiac arrest. For the liver detoxify these drugs we take. You understand?
Yeah.
And when we take these drugs, depending on how hard the drugs are, it kind of deteriorates the function of the liver gradually, not an immediate effect.
All right.
It
Like,
ca-
what was it? Was it 10? How long?
How long? Some can take months, some can take years.
Okay.
You understand?
Okay.
So this effect on the liver could make the liver to develop liver disease, liver total breakdown.
Is it cancerous too?
No, I wouldn't. No, it's not cancerous.
Okay.
It will make the liver not to function properly.
All right.
You understand? Even posing the liver to greater risk of infection. You understand? Then when we talk about the immune system generally, it affects the immune system.
Okay.
That make the person's, when the immune system is affected, the person becomes immunocompromised. You understand?
What did you say the person becomes?
Immunocompromised. When it's
Okay.
immunocompromised, that means the system can
Take
no
in
longer
anything
fight
and everything.
infections.
Yeah.
You understand?
Yeah.
The system can no longer fight infections.
Okay.
You get it?
Very well.
So that is for the immune system.
All right.
Then for the kidney,
Yeah.
the kidney helps to excrete. You understand?
Okay.
When the drugs also have a way of affecting the kidney as well, trying to create some kidney impairment, kidney malfunction. You understand?
Okay.
So it cut across so many areas and so many systems in the body, even as far as the unborn kid.
That's
The
for
unborn,
pregnant
yes, for pregnant women. For it can make the woman to have preterm births.
What's pretend birth?
Preterm birth, like premature babies.
Okay.
Yeah, premature babies. Some can even cause abortions. You understand? Some can go as well as even having children that have low
Deformity.
birth weight,
Okay.
having birth defects.
Yeah.
You understand? That can affect even their genetic makeup.
Okay.
You understand? So many drugs. Then now we talk about our homes generally. You know that when someone takes alcohol or takes drug or addicted to drug, the person does not behave normal. True or false?
By the time the person gets high or gets
The
intoxicated.
person does not behave normal.
Yeah.
So in such doing, perhaps maybe the person is married or have people who loved ones around. You see that they behave abnormal. Sometimes they behave. Yeah, what I mean abnormal. If imagine that maybe the wife comes around and say, please, daddy, there's no food in the house, or there's no money in the house. Please, we need money. The next thing the person may hear is a slap. Or probably the woman is, you understand,
Yeah.
asking for something which is more reasonable. Because of that person is already in a different state of mindset
Yeah,
or state of
yeah.
reasoning, it becomes a problem.
All right. Let me
You
bring
understand?
Solo Fight now because I know that he has questions for you. Solo Fight.
Okay.
Quickly ask him the questions that are running through your veins right now. So that
Victor, you talked about the pregnant woman. There's this misconception that is been making rounds that when some women are pregnant, not all women, when some women are pregnant, they believe taking alcohol helps during the phase of pregnancy. How true can that be?
Alcohol.
No, I've heard it. I've seen
Yeah,
various
those are
pregnant
kind of beliefs.
Okay.
But in the real medical system, it's not true.
All right, and you made mention of the effects of this drug abuse, be it alcohol, be it drug,
liver,
be it
kidney,
drug abuse,
immune
abuse,
system.
suppositories, injection,
Okay.
injection. You know, some people I've seen some medical personnel. They know of these effects. They are in the know of these effects, but they still go ahead
I take
and
them.
abuse.
They
those
say, okay,
drugs.
good. Like I
Because if you look at it from this angle, some of them are ignorant. They don't know the effects of these drugs, and they go ahead and take it. But these people, they know that
Good,
these
good,
are the effects
good,
of these drugs.
good.
And they still go ahead.
most of these
and take
people,
drugs.
most of these people you see that are addicted to this. Let me see. I'll use the word addicted to
Okay.
it because most of them they started it when they were teenagers, even before they became who they are now currently. You understand? So at when they grew up with it, the addiction became so strong in them that their system cannot do without them.
Even when they know the effects of
Even
these
when they
drugs.
know the effects. Like I first said earlier in our previous sections, that when these people began this, it was voluntary. Some were influenced, but at the time they became addicted to it. You understand? And when they became addicted to it, they can't live without it. even when they know the consequences. Some of them, most of them are medical personnel. Some of them know the consequences. But you see, they can't do it. That some of them even smoke. I've seen medical doctors that smoke.
Yeah, I have friends
I've
like
seen
that.
some that even take drugs. But the challenge is that they are so addicted to these things that they can't help themselves. You
Even
get
when
the
they
point.
know the implications,
Even
they
when
know
they
that
know
the
the
implications are
implications,
far-reaching.
even when they know the implications.
Okay.
There's another, before we just go, there's another misconception that I've seen people say it that whenever they are taking alcohol precisely, some people say, when I gulp it once, it doesn't do anything to me. That's when I am able to take 1, 2, 3, 4 bottles.
Shots.
Why some others say, when I sip it, take it slowly. Of course, we know when you take it slowly,
What's happening? It cut again.
they say 3 minutes to 10 minutes.
Wait, my battery off. No, for just cut and tell me.
If you gulp it once and you take it slowly, what are the effects of taking once and taking slowly? Does one kill faster than the other one?
No, gulping or sipping
Because you made mention of
does
the
not
liver
have
being able to
does not have
detoxify.
any both of them causes effect, whether you're gulping it or you're sipping it. But the thing there is, I should let you know, is that the way a drug you respond to a drug is different from the way you will respond to it. You take paracetamol, for instance.
Yeah.
If you take paracetamol, some people will tell you paracetamol does not work for me. Why someone will say paracetamol? When I take paracetamol, my system works for me, it brings me down, makes me sleep. You understand? Everything has to do with the body system.
Okay.
You get what I'm trying to say? So whether you're gulping or you are sipping, both of them has the same effect. Those belief of if I gulp it, if I sip it, it's just their belief system. As long as it's just like you taking 2 cups, I'm being served a cup of alcohol, and you are served the same cup of alcohol, and I decide to gulp mine all at once, and you decide to sip yours gradually. As long as I exhaust my own and you exhaust yours, it's still the same effect.
All right, don't you think that
depending on the body system.
don't you think that the liver takes more time detoxifying the one who gulped his alcohol than the other one that was
That's the one
taking
who gulped it faster.
slowly? Because
Remember, sorry, I'm cutting you.
okay, go ahead. And
Remember that we're talking about injection here,
yes,
and it has to pass through the digestive process.
It does.
Well, it has to get to the stomach before the breakdown and all that, and even to the liver, the ones that will be taken to the liver, the ones that will be absorbed through the intestines and all those ones. So, like I said, depending on the system of the person. Most of them, like alcohol, it's most of them start having effects right from the stomach. You understand? So, but whatever, as long as the quantity, depending on the quantity, people actually have different way they react to system. Like me, I was one time, I was in the midst of my friends, and they said, try it now. It will not have effect, just try. And I just, okay, I just took not even a cup.
Okay.
You understand? And I was already intoxicated. I could not move in fact, I could not even move myself. I had to take a lot of water to dilute, and I told myself never again.
Never again.
You get the point I'm trying
We
to
have
say.
to
So
go, guys. I'm looking at the
that
time
is the
now,
point.
and we have to run. Time is never enough. But then again, we would come back to this. We're certainly not done with this topic. Drug abuse is very broad, and we're going to talk about it. We've not talked about the solutions that would come, and we're also going to look at other things as regards drug abuse. And today, I had Victor, who is a medical practitioner, and also Solo Fight, who is a social commentator, a sports analyst, and then Analuta One Law. My name is Egudana Ifechikude, aka SUG the General, and this will be calling it a wrap for today. Do well to join us again. But before that, remember to like, share, subscribe, and comment. Bye for now.